At the beginning of this procedure, an ultrasound probe will be inserted into the woman's vagina so that her doctor can view her ovaries. Inside the ovaries, the doctor will look for follicles. Each follicle is a fluid-filled sac that contains an egg. Then the doctor will insert a long, thin needle into and through the wall of her vagina and guide it to the ovary. A suction device connected to the needle will collect several eggs from inside their follicles. During the second part of in vitro fertilization, called fertilization, the collected eggs will be taken immediately to a laboratory where they will be fertilized. Fertilization may be performed by insemination, where several sperm are mixed with the healthiest eggs. Or the eggs may be fertilized with sperm injected directly into them during a process called intracytoplasmic sperm injection. The fertilized eggs, also called embryos, will be monitored for 3 to 5 days as they begin to grow. At this time, the lab may create a hole in the zona pellucida surrounding some of the embryos. This process, called assisted hatching, will help these embryos implant in the uterus. Some of the embryos will be used right away for embryo transfer, and the rest will be frozen and stored for future use if necessary. The third part of in vitro fertilization is called embryo transfer, which is done 3 to 5 days after fertilization. During embryo transfer, a tool called a speculum will be inserted into the woman's vagina so that the doctor can see her cervix. A syringe will be loaded with fluid containing one or more of the hatched embryos. Then the syringe will be attached to a long, thin tube called a catheter. The doctor will insert the catheter into the vagina, through the cervix, and into the uterus. Once inside the uterus, the doctor will inject the embryos. Then the catheter and speculum will be removed. The woman may continue to lie on her back for about 15 minutes.